Mild illnesses are on the rise in schools and daycares 1 week after the lifting of New York's mask mandate.
This just happened last Wednesday. So, is it COVID? Is it just the cold that's going around? Is it the flu? Is it strep that we haven't seen in years in our facilities?
Yeah, hard to know, isn't it? Good evening. I'm Doug Embledge, in for Don tonight. It's been a week since face masks were deemed optional in schools and daycares across New York. Local pediatricians say they're seeing an influx of children getting sick with things like the common cold and stomach bugs. As Natalie Kuchko tells us, the germs may be spreading a bit more quickly now.
Yeah, Doug, well, kids are back in the classroom from February break, and in a week's time, both medical and school professionals say they've seen a difference in some illnesses they might not have seen as much during the height of the pandemic. Lindsay Plouffe of Pittsford just got rid of the cold in her house and says both of her young children caught it in recent weeks.
We definitely have felt it in our house. They both had runny noses and a cough. Sadly, I think in the last few weeks it's become more. It's going around more.
It's something pediatricians are seeing more of as well. Dr. Elizabeth Murray of the University of Rochester Medical Center says a number of factors are to blame.
I don't know that it's just exactly because of a few days post masks coming off. I think it's a couple things going on, but once these germs are in a classroom or in a daycare setting, they do tend to spread very, very quickly. So if we've removed a layer of protection, it is not surprising to see many children in a class or even adults in the classroom develop the symptoms as well.
At Pinnacle Lutheran Daycare in Henrietta, Executive Director Sarah Cole says since the mask mandate was lifted, there has been an increase in children out sick. She says they're working with parents to discuss possible next steps.
Of my, 5 classrooms at this site, all probably have had 2 to 5 children out a day, which is significantly more than normal. It was important for me to let parents know that we're seeing that difference, because then if they want to reevaluate if their child's wearing a mask or not, they should do that.
In the meantime, Dr. Murray cautions parents and children to pay attention to symptoms, continue proper hand washing, and test for illnesses when appropriate.
We want kids to be in school. We don't want classrooms of kids sick with whatever the germ may be. These germs are always still around. We've just kept them at bay, and they will come back like they always do.
Now, when it comes to flu cases, Dr. Murray says current numbers are considerably low, but says it is something that doctors are keeping an eye on.
It was a yearly physical, a mammogram, or a colonoscopy. For a lot of reasons, people have skipped their annual checkups and screenings during COVID.
And now, 2 years later, as Carla Rogner reports, doctors are beginning to see the consequences.
I don't eat sugar.
Elizabeth Fraser started experiencing unusual symptoms in the spring of 2020. She had to wait a few months for her health insurance to kick in. Then she made an appointment with her doctor.
Something just inside me told me, go get checked out.
After several rounds of tests, she was diagnosed with stage 1B uterine cancer. She's gone through intensive procedures, including a hysterectomy and removal of her cervix, ovaries, and fallopian tubes. But now she's on her way to being cancer-free.
Even the doctor said, they caught it early, which is really important. The earlier you catch it, the better your chances are.
Doctors say if she waited any longer to get checked out, the outcome could have been much different.
If I had waited, it would have gone to grade 2 or grade 3, and I would probably be at the end of my life today.
The medical community is concerned some patients won't be as lucky as Elizabeth. Research from the Hartford showed 43% of U.S. workers have delayed routine health care since the pandemic began.
If you miss a colonoscopy, the consequence could be a colon cancer. If you miss a mammography, the consequence could be a breast cancer.
Dr. Robert Cole, a physician with Rochester Regional Health, is beginning to notice the consequences of this dangerous trend in his patients.
We are beginning to see people in the emergency department, for example, who have clear evidence of having had a previous heart attack that went unrecognized by them. We've actually seen several cases where strokes have actually been missed by individuals, for similar reasons. Symptoms that went, don't want to say ignored, but they were not appropriately evaluated by a healthcare provider.
Dr. Apostolakis has seen similar trends of delayed health care at URMC.
The data is pretty clear that screening for certain cancers allows the medical profession to catch them at early stages and therefore treat earlier and have better outcomes.
There are many factors that may have gone into putting off healthcare, like fear of catching COVID-19. The doctors mentioned transportation or work issues, but some overwhelmed hospital systems have been unable to even offer preventive care. For people due for a screening or checkup that may have been delayed, doctors say to make an appointment now.
We want to catch medical conditions at the very earliest stage, where we can manage, what we've found. And in many circumstances, if we catch things, very early, we can not only manage them, but we can essentially eliminate them.
We are able to keep patients safe now through screening questions and the proper use of PPE. So to delay any care that you need for health maintenance or for urgent care is not encouraged. And we encourage people to come and feel safe in our facilities because of what we've learned in order to keep them safe.
Elizabeth Fraser says to take it from her.
Go get checked out immediately. It could save your life.
And the newest U.S. sanction on Russia, a ban on oil imports, is already having an impact. According to AAA, the average price of gas in Rochester is $4.38. That's up 5 cents from yesterday and more than 40 cents in a week. As prices climb, so does interest in electric vehicles. Chase Howell, live now with more on what he found out today. Chase?
Yeah, Jenny, some people are looking to trade in those gas guzzlers to save some money at the pump. They're looking at options like hybrid and electronic models, and even maybe taking a two-wheel approach at combating those gas prices. Pain at the pump has many people looking for relief.
Every vehicle that we've had that's been a hybrid or all electric has sold.
Kevin Parker, a managing partner of Garber Automotive, says people asking for a hybrid or electric vehicle has gone up 30 or 40%. He says gas prices have made it nearly impossible for people to get their hands on a fuel saver vehicle.
Most of the vehicles coming in are already spoken for, but should we have one that somehow slipped through the cracks and it's a hybrid, people are snatching it up left and right. When a truckload comes in, if there's 10 cars on them, 8 or 9 of them are already sold.
Others are ditching their trucks and sedans entirely, looking to cut their gas prices even more.
A lot of people are looking for smaller bikes to take around, to be right around locally around town. And then some of the bigger bikes they're also buying for road trips that they normally would take in their cars or their trucks.
McDaniel says it takes anywhere from $20 to $26 to fill up a motorcycle tank, cutting some people's gas costs in half.
The trends we've seen over the last 6 weeks with the bikes we sold last month and how busy we've been currently this month, we've seen it's about a 40% increase. So it's significant right now.
Now, for those that just can't trade in their vehicle, Gas Buddy says the best time to fill up is on Monday and to avoid days like Wednesday and Thursday.